the epidemic of drug overdose can't be solved overnight, but we have seen a rapid increase in the number of deaths from overdose, and it's time for the federal government to recognize that the lack of funding for treatment and enforcement is a contributing factor. Senator Blumenthal and I are here to suggest what we think are 5 common sense steps that we can start building a real program of support at the federal government. First, we have to acknowledge that as heroin addiction has increased, as overdoses have spiraled, funding for treatment has remained level. So we're going to be asking our colleagues to support an increase in drug addiction and drug prevention dollars to the state of Connecticut in the coming budget. Second, we need more support for law enforcement as well. Third, we're calling for increased prevention focused on the intersection between heroin abuse and prescription drug abuse. Often you see tremendous intersection between people who are abusing prescription drugs and are using heroin. Fourth, we're going to be supporting our colleagues' efforts in Hartford to pass legislation, the so-called Narcan bill, which would allow greater access to that particular drug and intervention. And then fifth, we're encouraged by some local collaborative efforts that have sprung up all around the state that we think are really making a difference.
When we see somebody in the emergency department, it means there's a real problem in the community. Right? Either it means things have really blossomed, or there is something else in the drug stream, as it were, that is much more potent. And either that's the potency of the heroin, or, as already been mentioned, other things that have been adulterated into it, including the very potent fentanyl, which is about 100 times as potent as morphine. Thing is, the people out on the street are not good chemists, and they don't mix things really well. So you may get a little bit, or you may get a lot, and you don't know until you've had it in your system. So when we're seeing the people, then we know there's a problem in the community. There may be 1,000 people out there using for every person who comes in, or whoever, for every fatality that we have. So there needs to be community treatment. And as already been mentioned, one of the pathways for this problem is often through prescription drug abuse, and that's that's a societal problem. That's how we as physicians prescribe medications. It's how we treat pain. It's how people who are coming in with pain demand medications, and so it's going to be an important partnership. But I think these steps, especially getting some support out there for harm reduction and keeping people alive to get into treatment, is going to be a real important one.
This kind of effort requires sustained, patient, committed effort and partnership among communities, not just one day when this issue is in the headlines, but over a course of days, months, years, such as the great professionals here are giving it. They know firsthand from being in the trenches the toll taken by heroin addiction.